5 things that are not normal in nursing, but we've been taught and conditioned to tolerate them anyway. Hi, I'm Dr. Day, and I help nurses who are looking for clarity and confidence in their nursing career journey. And I'm so excited for this 5 in 5, right? This is 5 in 5. 5 tips, suggestions, recommendations, pieces of advice, or just observations. Um, and I have to cover those in 5 minutes. So anybody who knows me knows I'm a talker. I can talk. I have lots of words and metaphors to say all the things I want to say, but you didn't come here for all of that extra, right? I'm going to try to be as entertaining as I possibly can. But I do acknowledge that when you come here, you are seeking information first. If you want to get entertained, you turn on Netflix. So, anyway, I have put up here a timer. Am I circling this? I hope so. I hope I'm circling it correctly. I think so. I practiced this, y'all. This is my timer. It's going to try to keep me honest. I'm going to try to stay within the 5 minutes. I'm not always successful, but I promise you I'm doing my best. And I don't go much further outside of 5 minutes. 5 minutes for these pieces of observations and things that I've seen in my years and years of being from the bedside to the boardroom within this nursing profession. So thank you for being here. Please subscribe to this channel. I would love to have more conversation. I'd love to hear from you about things that maybe you'd like to hear me talk about or share or find out more information about. So please like and subscribe. Thank you. Appreciate it. Public service announcement is over. I am Dr. Day. I am a second career nurse. I was in marketing and corporate advertising for about 15 years before I went into being a nurse. I wanted to have more purpose. I wanted to have more of an impact on the world around me and to help people. And so, long story, if you go to the video about my why, you can hear how I made that transition, why I did that, and kind of some of my bumps and bruises along the way. But I did want to just make sure that I let you all know how much I value your being here. We are all struggling with trying to make it through this nursing journey. Some of us have our roadmap plotted out very well. Some people are learning and pivoting along the way and try and figure these things out. And so I welcome both. You know, if you all have wisdom and advice to share in the comments as well, please don't hesitate to do so. So I'm getting ready to start this timer. We're going to dive into this right now. 5 things that we've been tolerating and we need to stop doing. All right. So let's keep it real. We all have bodily functions. We all have things that we have to do. Excuse me. Not peeing for 12 hours or any number of hours is not okay because you don't have time to go or you don't have time to drink your water. You got to stay hydrated. You have to take care of yourself. Okay. I remember one time putting it off and putting it off. And then I had a patient who crashed. That I had it in my head that as soon as I get done with X, Y, and Z, I'm going to go take my break. I'm going to get it in. I should have went when I had a chance, y'all. I was in the middle of a code, needing so badly to go and use the restroom. Take care of yourself. Don't be in that situation. There were no mishaps, but hey, listen, it was close. It came real close, way too close, y'all, for comfort. All right, number 2. Getting shamed for asking questions. This is particularly for anyone who's new in their environment, not necessarily brand new nurses, but if you're new to a unit, new to a role. I've seen nurses who've been nurses for 15 years and then got into leadership and were shamed for asking questions then. And that's not okay. All right. Nursing is a practice. Nursing, we are all learning. And just a note to anyone who's getting new into anything, you will never know all the things. I say this to nursing students. They're like, oh, I can't wait. I can't wait till I become a nurse. And I'm going to get in there and I'm going to know all the things and it's going to be smooth sailing. No, there's always some new practice. There's some new protocol. There's some new medication. There's some new piece of equipment. There's some new way of doing things. So we thought this was the best way of doing it 15, 20 years ago, but now we've got a new way of doing X, Y, and Z. Documentation, the things that a nurse has to do, those things are constantly changing. So never think that you're going to know all the things. We should all be asking questions. Don't shame anyone for asking questions and don't feel ashamed for asking them. Number 3, this is really a segue into this. It's almost a little bit of number 2. right? We've got, oh, y'all, look, the timer. I'm about halfway through. Okay. And I'm on number 3. Okay, we're doing good. That toxic culture of eating your young. It is still happening, y'all, and it is really ridiculous. I think, though, this newer generation pushes back a little bit more than maybe my generation did, and definitely generations beforehand. But push back on that. It's not okay. It's not okay, the eat your young mentality. As a more experienced nurse, you have the opportunity. It's such a great opportunity to be in a leadership role, to be a mentor, and to help someone else. You never know. Through mentoring and supporting that other nurse, whether they're new to the unit, new to the environment, new in their role, you could still be helping save a patient's life. Think about it like that. So if we're shaming people into not feeling like they belong in the profession, that's not okay. All right. Number 4, unsafe staffing ratios being passed off as normal. I'm from Georgia. We don't have ratios like they have in California where there's some protections. So you have to protect yourself. If you're in an unsafe situation, if your ratios are off and you're not being staffed appropriately, speak up. It's not just your license you're protecting. You could be saving the life, but you have to protect that nursing license, right? You don't want to make a mistake because you've got too many patients. You're overwhelmed, and these systems look at nurses and patients like they are numbers. And I hate to be blunt when I say that, but that's the only way you can describe how some of these decisions are made. Every patient that's in one space does not have the same needs, does not have the same acuity. And so we should be staffing more to how we are taking care of patients, not just a number in the staffing grid. And number 5, I got 44 seconds. Okay. Being guilted for wanting better. If you say, I want better ratios, if you say, I'm not going to take all those extra shifts, even though other people may pick them up, that's their prerogative. If that's not working for you, don't do it. Okay. Don't be guilted into wanting something better. Don't feel like people are going to try to make you feel like you think that you're better or that you deserve more. And they'll say, well, that's just nursing. It doesn't have to be. All right. That's it. I think I did it. 10, 9. Okay. So I get to say one more thing. Y'all take care of yourselves, take care of each other. If we want to continue to have this passion in this nursing profession, we've got to do it. You owe it to yourself. Have a great day, and I'll see you at the next 5 and 5.